Hi there, I'm Dr. Megan Von Holtz. For this week's tip of the week, I thought I would go over one of the tools that we have in the office that I've been having great success with lately. We've only had it about 2 years and I'm starting to use it more and more. So I thought I would teach you a little bit about it and do a demo and we'll go from there. It's called the SRT, or the Spinal Rejuvenation Table. It's made by Pedibon Institute, which is the same company that we use for a lot of our weighted exercises. It's a company that I really like because they never make anything without doing research first to find out what's actually best for people. In some ways this is similar to an inversion table, but they did a lot of research before they made this, trying to figure out what is the right or wrong amount of inversion. I know sometimes on TV you see those tables and the guy flips all the way upside down and you can just picture in your head like, blood rush, is this really a good idea? And they found in those studies that you really don't want to invert any more than 29, 30 degrees, because after that point the muscles in the body actually contract more than the machine actually decompresses, so you get no net benefit from that. So that's a tool for you if you have a machine, and that's something that they kept in mind when they made this table. So Christy's going to help me demonstrate. We're going to use it. We can do a lot of things on this. I can use the neck piece. I can use a low back piece. I use this a ton for patients with scoliosis or patients who can't tolerate normal decompression. So we're going to demonstrate the lumbar. First thing, we want to work on laying properly. So she's sitting and she's going to kind of lean toward her shoulder. She's going to use her tummy muscles to bring her legs up and then roll on her back. And then nice and easy. Yeah, most people lots of times can only do 1 foot lifting at a time, but we got her set. And then this just comes down to secure the feet. Now there is another way to do it with a lumbar belt. A lot of people prefer this way, so I'm going to demonstrate it this way. And it'll take a bit, but the table's going to come up. And then really gently we're going to bring her down to get some of that inversion. And one of the neat things about this table, there's actually a way to tell how much on this dial here on the side, how much we're actually inverting. So this is about 10 degrees, so it's not very much, but this might be that all someone with scoliosis that can tolerate because their muscles are working so hard anyway. So she just feels this gentle pull. The other thing that we do usually is we do put a pulse ox on people just so we can check throughout the treatment that their vitals are doing well. Sometimes people do great for 5 minutes and then that's all that their body can tolerate. So this is a way for me to check. My absolute favorite part about this machine is it has a vibration component. If I come here and turn this on, so now it's really loud so you can barely hear me probably, but the whole table actually vibrates. And the great thing about vibration is we use it for a lot of things in the office. You'll see it in gyms now. It's a way to trick the muscles. So a lot of people I put on this, they have really bad low back or neck spasms or the scoliosis type spasms. And they can't consciously relax their muscles very well. Or you have those people who no matter what, it looks like their shoulders are growing out their ears because they just can't make themselves relax. The vibration, your body feels that and it gets tricked. It's not really sure what to do. So a lot of times you can trick those muscles into relaxing. And when they're relaxed, the pull works a whole lot better. So this is one common way that we do this. Lots of times we start just 10 minutes, we build up to 15 or 20. And like I said, I can show you another time on the neck, or even just using the flat vibration. We've used it especially for people, tall people who have pain right through here where the ribs end and the low back starts. You know, that's where they bend all day, and no matter what, adjustment-wise, it's really hard to get that to move. I can throw them on here 10 or 20 minutes before we do the adjustment, and it works so much better, and they love it. So I just wanted to share this because it's a tool that I've been using more and more, and it's really great in a place like Advanced Rehab and Medical to have all sorts of different things in my toolbox because not everybody is built exactly the same. I'm Dr. Megan Von Holtz. Thanks for joining us for the tip of the week.